today's class. And today we discuss something about the bovine and bovine infertility, the non-specific genital affections. So it will include the affections of the uterus, the affections of the cervix, the affections of the vagina, those of the ovaries and the fallopian tube. But they are the non-specific ones. They are not involving any specific infectious disease. So I call them as non-specific genital affections. But they are the ones which are met most commonly by the clinician in his clinic, right? So let us discuss one by one. As I said earlier, they include the affections of the ovary, fallopian tube, uterus, cervix, vagina, and vestibule. And the non-specific ovarian reasons for infertility in cattle and buffalo include ovaritis, ovarian abscess, ovarian tumors, and ovarian cysts. The ovaritis, or also known as oophouritis, is the inflammation of the ovary, and it can occur secondary to trauma, infection, traveling and reaching to the ovaries through the uterus, and extension of infection through the uterine walls. The diagnosis and the treatment are not easy, because for diagnosis you need to have an ultrasound examination, and the treatment, if it is bilateral, then it becomes very difficult. And once the infection is bilateral, the animal usually becomes sterile. So as I said, then the ovarian abscess, a infrequent cause of infertility in cattle, and ovarian abscess are detected by ultrasound examination, or maybe by transrectal examination they can be detected to some extent. Then the ovarian tumors, the ovarian tumors are infrequent, and the common ovarian tumor is the granulosa cell tumor. And animals suffering from this, the granulosa cell tumor, exhibit signs of altered reproductive cycle, maybe nymphomania, maybe sometimes anestrus, and infertility in such cases. Most tumors are benign. The progesterone and testosterone levels might be elevated, and the plasma inhibin and anti-Mullerian hormone levels are also elevated. Now, there is a honeycomb-like appearance when you visualize such a condition using transrectal ultrasound. But by transrectal palpation, sometimes you are not able to make it out whether it is a big ovarian cyst or whether it is a granulosa cell tumor. Then the surgical removal by flank ciliotomy is suggested if the condition is unilateral. We have operated 2-3 cows in which the condition was unilateral, and then the animal became fertile again, right? Then the next is the ovarian cyst. Ovarian cysts are occasionally found in the broad ligament. Sometimes they are located adjacent to the ovary. They are less important clinically, and there are rare reports of anestrus in such cows. Then serosal cysts may be noted on the ovarian surface, and they are usually diagnosed by transrectal ultrasound only. They are usually not diagnosed using the transrectal palpation, right? Then the oviductal affections. The oviductal affections include salpingitis, and which usually result from the passage of uterine infection in the oviduct. This may also occur following the infusion of large volumes of fluid in the uterus, and it is difficult to be identified clinically because the fallopian tube is very small, and until unless the salpingitis is extensive and the fallopian tube size diametrics have increased extensively, it's really not possible for a clinician to diagnose the oviductal affection like salpingitis. Then hydrosalpinx or hydrosalpinx or and although more, there is really no treatment for salpingitis. If the animal is affected bilaterally, then there is simply no treatment. Most treatments fail. Hydrosalpinx may occur because of anatomic defects, and pyosalpinx is less common. These problems can rarely be diagnosed by routine rectal palpation and sonography unless the enlargements are extensive. If the enlargement is very small, then it's really not possible to be detected by transrectal mm, palpation. Uh, TSP dye is suggested for testing patency of the oviducts as they may occlude the lumen because of the presence of pus or maybe because of high volumes of fluid. They may sometimes occlude the lumen and one may require a PSP test to be done. Then unilateral and bilateral hydrosalpinx have been reported in buffaloes as well, but these have been detected in the abattoir material, and so they have little clinical significance, right? Now we come to the major issue, which most clinicians are facing in the field, that is the uterine infections and affections. Uterine infections are one of the most frequent cause of infertility in cattle and buffalo. The uterine infections manifest in different ways when they occur during the postpartum period, which is most frequent in cows. Clinical conditions identified during the postpartum period include the puerperal metritis, the clinical endometritis, biometra, and subclinical endometritis. Other problems in the uterus include the uterine abscess, tumors, and mucometra or hydrometra. Right. Now, metritis frequently develops during the postpartum period. Why? Because during the postpartum period, the uh, birth canal is widely open and facultative organisms in the environment and soil may enter the uterus, causing a huge infection. Now, metritis may rarely occur at other times as well, and metritis involves inflammation of all layers of the uterus. Uh, and questions have been asked: what is perimetritis? When the outer layer of the uterus is involved, that is known as perimetritis, right? Metritis leads to discharge of obnoxious uh, fluids and pus. And during the postpartum period, if metritis is present, it should be attended on a priority because it causes loss of milk. The animal becomes off feed, and there are other problems as well. The predisposing factors for development of metritis is poor parturient hygiene and postpartum reproductive and metabolic disorders. Now, to some extent, the repeat breeding in animals also develop because of the poor parturient hygiene. At the time of parturition, if the hygiene is not proper, animal is and during the delivery of the fetus, if the animal owners are applying sand to their hand to pull the fetuses, that really causes a lot of problems to the animal at a later time. And then increasing age and parity and poor feed intake during the terminal gestation. These could be reasons for development of metritis in dairy cows, right? Now, the microbes involved in the development of metritis in cattle, the most commonly identified microbes include E. coli, Arcanobacter pyogenes, Fusiformis necrophorus, and the incidence varies from 15 to 20%. Now, this is the diagram showing the pathogenesis of the metritis. There is bacterial invasion, and stagnating bacteria lead to degenerative and infiltrative processes. There is bacterial spread and release of endotoxins. There is release of histamine and pro-inflammatory cytokines. Inactivation, which inactivates the prostaglandins, which are causing the contractions in the uterus. And then there is decreased appetite and milk, and the animal may develop fever. There is delayed postpartum involution, there is delayed postpartum estrus, and then there is a systemic reaction, and the local discharge that is coming out during the postpartum period becomes fetid, and it is malodorous, fetid, and very mucopurulent type, right? The clinical findings in metritis, animals can develop fever, reduce feed intake, and decreased milk production. The enlarged atonic uterus gives fetid, watery, red brown discharge, and the fever may be inconsistent. It's not necessary that all animals suffering from metritis develop fever, but a fetid, malodorous discharge is frequently present in metritis. Toxic puerperal metritis is the severest form of the disease in which symptoms of toxemia appear, and so that is the severest form of metritis in dairy cows and dairy buffaloes. Now, how to diagnose? The diagnosis of metritis is based on the history, based on transrectal palpation. When you palpate the uterus, you will find that the uterus, many days postpartum have passed and still the uterus is enlarged. Fetid discharge is coming out. You can use trans rectal ultrasonography. You can use vaginoscopic examination and the white side test, right? So, if you have the if one has the facility of ultrasound, then one can see that a lot of pus, lot of fluid is present in the uterus, and echogenic strands are present, and that is confirmatory. Yes, the animal is suffering from metritis. The therapy, keep in mind that during the first 10 days postpartum, if you try to infuse intrauterine medicines, most intrauterine antibiotics are ineffective. Why? Because there is plenty of fluid, plenty of tissue debris, and the volume of the uterus is large. So, don't use the intrauterine antibiotics during the first 10 days postpartum. Instead, use the systemic antibiotics like maybe ceftiofur, ampicillin, tetracyclines, gentamicin, or cefepime, and infuse the supportive therapy whatever is required. Maybe fluid replacement, maybe administration of antihistaminics and liver tonics, antipyretics if fever is present, and provide all the supportive treatment, fluid replacements, antibiotics, and after 10 to 12 days, you start the intrauterine antibiotic administration. You can use uterine lavage using normal saline, and one can even combine a combination of the antibiotics to combat the uh, anaerobic and aerobic bacteria both. So you can use a combination of penicillins with metronidazole or tinidazole or whatever you wish to use, right? Then puerperal metritis during occurring during the puerperal period during the first 2 weeks calving. It's characterized by a large amount of foul-smelling, reddish-brown, putrid, watery discharge, which is malodorous. Systemic signs may be present. The sclerotic metritis is caused by severe chronic metritis that has destroyed the endometrium, and fibrotic changes have occurred in the uterine wall. The endometrium is transformed into a thick, dense layer of connective tissue. The condition often involves the cervix. It should be differentiated from adenocarcinoma, which it closely resembles. The animal fails to show eastrum, and the CL is deeply embedded and does not respond to luteolytic drugs. Then, what are the consequences of metritis? Metritis usually results into reduced milk yield, delayed conception, increased risk of developing clinical endometritis, increased risk of culling, where when the cows are having long intercalving intervals, then they are culled. So, and then it leads to off, the animal becomes off feed. So if the animal is off feed within 10 to 12 days of parturition and not showing any other signs, the uterus must be examined for presence of metritis. So this is an important clinical condition and one should remember it. Then pyometra is the accumulation of pus in the uterus with a persistent Cl. This makes the animal anestrus. The condition may occur postpartum when endometritis does not resolve and an animal has an ovulation resulting in the formation of the Cl. The condition can also occur post service, frequently because of Trichomonas fetus. Post service pyometra can occur because of Trichomonas fetus, and one must be careful if the animal develops pyometra after a service, then one should always suspect for the presence of Trichomonas fetus. But if a animal develops pyometra after parturition, then it's not necessary that Trichomonas fetus will be involved, and other organisms should be looked for. Then you can see in these pictures how pus is accumulated, but these are abattoir derived. The Tailorella pyogenes and Physoformus necrophorus are commonly involved during the postpartum period, and cows with clinical endometritis that ovulate commonly develop pyometra due to multiplication of microbes in the presence of an active Cl. The diagnosis is based on presence of an enlarged uterus. You can feel the duffy nature of the uterus, and in some cases, there will be discharge, constant discharge of pus outside, foul-smelling discharge, and on ultrasound examination, you can visualize the presence of echogenic strands within the uterus, which has also got the fluid. The therapy involves the administration of prostaglandins, because here we need the prostaglandins to lyse the Cl, and then once the Cl is lysed, then you can use intrauterine antibiotics, uterine lavage using normal saline, and then you can use the imidazole derivatives for intrauterine therapy, right? Then endometritis, the second condition is endometritis. Clinicians often find these types of cases, uh, especially if the animal is a repeat breeder. Inflammation of the endometrium of the uterus frequently occurs postpartum, but may occur at other times, also subsequent to copulation, poor hygiene at AI, and because of reinfection after recovery from metritis. Now, how to differentiate endometritis? Endometritis involves only the endometrial layer, whereas metritis involves all the layers of the uterus, including the myometrium. But the difference is that in metritis, you will invariably find a systemic reaction. The animal becomes off feed, but cows suffering from clinical endometritis, they will have no other clinical finding other than the discharge of cervicovaginal mucus with flakes of pus, specks of pus, or maybe mucopurulent discharge as well. The endometritis have been defined as the clinical and subclinical. Inflammation of the endometrium 4 to 8 weeks postpartum involves the clinical and the subclinical endometritis. The predisposing factors involve abnormal parturition, metritis, negative energy balance, periparturient disease, vaginal prolapse, poor hygiene at breeding. So these can all lead to clinical and subclinical endometritis. In clinical endometritis, clinicians will find mucopurulent discharge or flakes of pus in the cervicovaginal mucus, and it occurs 3 to 8 weeks postpartum. but can occur after use of contaminated AI gun for insemination. An ultrasound can reveal increased endometrial thickness or fluid accumulation, as you can see in these ultrasound pictures. And there is a device which is marketed by some companies, that is the MetriCheck. You just introduce this device inside the vagina, and there is a cup, and any pus present there will be accumulated in this cup, and when you retrieve it, you can see the pus and confirm. Then biopsy or microbial evaluation is of not of much clinical significance, because biopsy is an invasive technique, and microbial evaluation, until unless you use the specific sample collection equipment, then you cannot be very sure, because if you just directly introduce a swab inside the uterus, then the facultative organisms in the cervix and vagina will also be there, and they will contaminate the specimen. Then there is one condition which is now talked about very frequently, and that is the subclinical endometritis. The subclinical endometritis, usually these types of cows will show repeat breeding. They will not settle to services. And it usually occurs 8 weeks postpartum. The mucus discharge is clear, the animal will show repeat breeding, and you will have no clue what could be the reason for the animal repeating to services. So there is a small this sample collection equipment which has been designed, and you can use this is introduced in the uterus and rolled in the uterus and collected back, and it is spread on a slide, stained, and examined for the presence of polymorph nuclear leukocytes. Then, if the polymorph nuclear leukocytes is more than 5%, then that case is considered as subclinical endometritis. Then there is a white side test for diagnosis of clinical endometritis, and 1 ml of cervical mucus is heated with an equal volume of 5 to 10% sodium hydroxide. The yellow color appears because of higher leukocytes that react with the sodium hydroxide, giving a yellow color, as you can see in this picture, right? Then uterine abscess is rare and painful on palpation. Multiple nodular structures can occur in an animal suffering with tuberculosis, and ultrasound can be helpful in diagnosis. Broad spectrum antibiotics can be tried, but uh, the uterine tuberculosis is really very difficult to treat, and miliary tubercles will form elsewhere around the uterus, within the uterus, and at other places. So the animal becomes infertile and useless for the owner. Then uterine tumors are infrequent in cattle and buffalo. A tumor may cause bleeding from the uterus during estrus due to the contractions that occur over the tumor. And adenocarcinoma is one such tumor. And frequently, when such a the cow with adenocarcinoma type of tumor in the uterus, the owner will give a history that bleeding starts as soon as the animal comes into estrus, because when the uterus contracts over the tumor, it leads to bleeding in the tumor and the blood comes out. Tumors may sometimes interfere with the progression of a pregnancy when they are sufficiently large, even if a fibroma is present in one of the uterine horns, and the animal becomes pregnant. But because of lack of space for attachment, the animal will abort. And we have seen some fibroma in cattle, which leads to such type of problems. So here is a picture of adenocarcinoma in a cow. This is a fibroma recovered from the uterus of a animal. We performed a flank laparotomy and took this out, and after that the animal became pregnant. Then fibrothecoma can occur. Hysteroscopy is difficult to be performed in cattle, but one can use hysteroscopy if the cervix is sufficiently dilated using a pediatric uh, scope. Then mucometra. This is a very problematic condition because it's a sequelae to long-standing cases of ovarian cysts and frequently poses diagnostic problems as pregnancy to clinicians. Animal owner brings a animal to you, and when you palpate it, you will find the uterus is fluid-filled and large. You frequently consider it as a pregnancy, but the animal owner brings it back after 21 days saying with the same complaint, the mucus is being discharged and the animal has returned to estrus. So examine it carefully. If you have ultrasound facility, it's well and good. But if you don't have a ultrasound facility, then keep in mind or make a note on his prescription, his or prescription, owner's prescription, that this is what I am feeling. And after 21 days, if we bring the animal back, then you should have an idea. If it was a pregnancy, it should have enlarged. But if it is mucometra, the same size will remain. The therapy involves the use of prostaglandins and iodine preparations, such as the IFRH, or oral feeding of potassium iodide for a couple of 8 to 10 days can sometimes help. Then cervix, common problems of the cervix include cervicitis, cysts of the cervix, complete stenosis or obstruction of the cervix, mucocervix, and some cervical tumors. Now, cervicitis frequently follows metritis or vaginitis, abnormal parturitions, dystocias, and can be diagnosed on vaginal examination with a speculum and a source of light. The external os of the cervix is usually edematous and swollen. The mucosa is cherry red in color. Cervical stenosis may follow severe infections and trauma. Therapy usually involves the treatment of the primary cause and application of emollient uh, antibiotic containing creams. A common finding in cows is the presence of a kinked cervix, S-shaped cervix that poses difficulty in passing of the insemination gun. A beta 2 adrenergic is suggested at the time of insemination, such as the Duadilan or isoxsuprine 10 to 12 ml intramuscular, and the stenosis may follow chronic infection. So sometimes the cervical problems are difficult to be treated. So here you can see animals with cervicitis, inflamed, or maybe the cervix is enlarged, and cysts of the cervix are observed occasionally and are called the Nabothian cysts. They are retention cysts of the cervical glands. They may be congenital, but usually acquired secondary to trauma. A part of it may be seen on external loss on examination. They may recover spontaneously or incised by a needle, teat, bisturi, or a knife. So this is an Nabothian cyst. They can also occur in the buffalo. The cervix has a large population of Nabothian mucus secreting glands. They provide lubrication during coitus and a cervical seal during pregnancy. It is when the secretory ducts of these glands become occluded that Nabothian cysts develop. In cattle, copious amounts of mucus are produced by the cervical glands during estrus, but little and of a more tenacious nature during the luteal phase. Unless Nabothian cysts are huge and impede copulation, sperm transport, or even artificial insemination, their effect on fertility is insignificant. Right? Then vaginitis, this may occur following trauma, lacerations, and bacterial, viral, or protozoal infections produced at the time of dystocia, phytotomy, prolapse, or postpartum metritis. Sometimes it may occur due to other reasons also. The signs of vaginitis include mucopurulent, yellow-gray pus discharge from the vulva at irregular intervals, that mat the hair of the vulva, tail, and buttocks of the animal. Right? Vaginitis is frequently seen in cattle due to IBR, and such animals may recover spontaneously, whereas that after metritis may require therapy of metritis. Vaginal pessaries or creams may be used. Cysts and tumors of the vagina are rare. Then vestibulitis and vulvitis are rare and treated like with the same treatment used for vaginitis. When cows sit on the inflamed vulva or when wounds remain for a long time, maggots may appear that require the removal and application of turpentine oil or sprays that may repel the maggots. Cystic strictures in the vagina. Bartholin glands are anatomical analogues of bulbourethral glands, also known as the Cowper's gland in males and referred to as the major vestibular glands. Cystic Bartholin glands likely have little effect on the reproductive efficiency unless, as has been reported, they become so large as to protrude through the vulvar lips and become contaminated, predisposing the animal to vaginitis. Right? So this is a cystic Bartholin gland. And cystic Gartner ducts are remnants of the Gartner's ducts are the remnants of the mesonephric Wolffian ducts present in the bipotential early embryo. These glands are analogous to the prostate gland in males. Gartner's ducts were present in approximately 1% of the samples submitted to the abattoir. In most cases, cystic Gartner's ducts do not interfere with reproduction. So they are of not much significance. Then vaginal tumors, squamous cell carcinoma, fibroma, fibrosarcoma, leiomyoma are common, and these tumors can be removed by ligating the pedicle at 2 points, incising from the middle, and then checking if the bleeding is continuing. Then you have to again ligate the bleeding vessels, or you may use the cryosurgery weapons available nowadays, and you can remove these tumors easily. Most of these tumors are diagnosed as an accidental finding, yeah, after parturition or maybe during an AI, and they do not pose any clinical sign which can lead to early diagnosis. They are found as a accidental finding during your routine diagnosis. So hope the class was useful. If you have any doubts, if you have any questions to ask, you are most welcome. If you have any suggestions to me, I'll be very much benefited by your suggestions. And I hope you are enjoying the live classes. And let me know if you have any questions or anything in which you want to ask or which you want to uh, need me to answer or need me to update or something, you're always welcome. So, friends, if you wish that I continue, kindly watch my YouTube channel also, where in I am hosting a lot of videos. Kindly share and subscribe to my channel, GNP Sir, and kindly join our other courses. For say for JRF, we have a course in the Sushruta uh, batch, which in which we have live classes for all the three clinical subjects. You can also join animal science courses, the Ashoka batch, and you can join our test series as well if you feel like that they can be helpful. If you wish that I continue these lectures, kindly give me your suggestions, and kindly I'll be more than happy to answer any of your queries or questions. So, since there are no questions, I'm highly thankful to all of you who have joined this live class, and see you again in a subsequent live class, which I will schedule again. And hope you will enjoy learning with me. Have a nice time. Excel in all your examinations. Bye bye. Bye bye.